Now let's understand these USMLE questions. Now, in the history of examination, these are the most realistic exam to your actual clinic or an actual hospital, and which is why they are the most popular ones. Okay, but at the same time very difficult. So yes, everybody wants to think about USMLE, but many stay away from it. I always tell students, okay, this is your opportunity. Here is an exam which enhances your clinical skills. Here is an exam which enhances your diagnosing skills. Here is an exam which gives you various clinical scenarios, various patient cases. Take it and grab it with both hands. Especially those who are 2017 batch onward students who might probably have to write the next exam. You need to take these exams seriously, because if you are studying as a USMLE level student, I mean, you can really crack any other examinations, all right? And the best part is, earlier there were 4 exams, and now there are only 3 exams, and all of them online, okay? All of them online. Only difference is that step 1 you can give it in India, CK you can give it in India, CS happens in America. Okay, step 1 you can start preparing from first year, you can appear in third year, CK in internship. Only after graduation and passing step 1 CK and meeting the pathway requirements, you can give your step 3 exam. Step 1 is online, 8-hour exam, 7 blocks of 40 questions. Step 2 CK online, 8 blocks of 38 questions. Step 1, all your basic medical science, first 2 year subject, anat, patho, pharma, physio, biochem, behavioral science. Subject is similar to your PSM and psychiatry. Okay, so these are all first 2 years MBBS subjects, and CK is all your clinical subjects. Step 1 and CK, it does not matter, all of them have clinical scenario question. Every question of USMLE is less than 1 minute for you to appear. 40 questions, 60 minutes. And there is a clinical scenario. So I always tell a student, USMLE exam is nothing but a very, very busy day in your clinic where you are going to see 280 patients. Okay? In case of CS, it is 318 patients. So try thinking when you enter your anatomy class, what am I learning today? How am I going to apply to treat a patient? As long as your focus is patient, these exams are easy. If you are a person who will just memorize things, I'm not sure how these exams work for you. Okay? Examination fees keep on changing. 2021, they again increase the fees. Step 1 is $1155, CK is $1175, and step 3 is $895. Step 1 CK, both are 1-day exam. Step 2 CK is a 2-day exam. Day 1 MCQ, day 2 first half MCQ, second half TCS clinical case simulation. Those who want to understand actual USMLE exam, we conduct mock examinations, free mock examinations. Please reach out to us. We will send you a link and you can give your free mock USMLE just to understand how the exams work. Also, there is a handout attached here. So if you can open the handout, you can actually see individual subjects for clarity's sake. Unfortunately, this is a older handout, so you will still find the mention of CS examinations, which we and our team definitely needs to remove it now. So yes, CS exam no longer exists. So otherwise, yes, for step 1 and CK, these are the subjects. Okay. So in case of step 1, your first 2 years, step 2 CK, final year subjects. So those who want, you can just download this handout for your future reference. All right. Perfect. The scoring system of USMLE is a little different. Okay. Unlike this examination, your Indian exam, 1 right answer gives you 1 point. It's a scale. Everybody gets minimum 140, maximum 280. Okay, whether it is step 1 CK, CS, this is how scoring system works. Okay, your passing marks is 194, good score is 240. Okay, that is your target. Your scores get locked for 7 years. If you pass, you cannot improve the score. Listen to me very, very carefully. For those who are typing Sir 2022, this is pass and a fail. Yes, it is a pass and a fail exam. However, what does that mean? They will only release whether you passed or not. The scoring scale is not changing. Okay? At this point of time, more than 75% students pass. We don't know once the exam becomes pass and a fail, will this decrease? Will this marking scheme increase? All they have said in 2022 is that they will not release how much of 3-digit score you got in your transcript. That's it. For CK, you still need to get your target of 240. For step 3, you need to get the target of 240. Usually what we have seen, if your 50% answers, 50 to 60% answers are right, that's when you pass. And if your 85 to 90% answers are right, that's when you get your 240 marks. Okay. Again, it depends on a lot of factors. For example, one of the factor is, have you attempted each and every question? If you leave incomplete blocks, again your points go down. So there are a lot of factors involved, and when we do the study strategy session, we'll be discussing that much in detail. But what I want to enhance and emphasize by this, that this is a serious exam, and you guys need to ensure that you will actually prepare well. Don't think of attempt. If somebody fails, of course there are multiple attempts, 3 more attempts you get, but these are expensive exams to fail. Moreover, if you fail, your probability to get match decreases by 33%. So why do you want to take a risk? Okay, so unless and until you're hitting your 240s in your NBMEs, don't appear the actual exam. That is the only recommendation I have for each one of you. All right, let us see next few questions. I will talk about individual cases of when to give exams and all. I will talk, at the end I will take up those questions. No, so if I write my step 1 in 2021 and apply in 2023, will my score get counted? I am telling each and every student who is asking me, because this is the hot question right now. When do we write step 1? Okay, people are telling, there are groups, there are a lot of these blogs. Should we write in 21? Should we write in 22? My answer is, you should write when you are ready for the exam. Forget about whether the score is getting released or not. Okay, question for Siva is, Siva, that if I appear in 21 and then apply in 23, what will they see? Shiva, what they will see is not the 3-digit score, because your peers might not have it, but definitely they would want to know, did you pass the step 1 exam in first attempt, yes or no? Yes, that is what Shiva they will see. So those who are asking me this question, should I wait? Can I give? Should I give after 22? We don't know. Okay, the exam might become difficult. So answer is that if you are prepared this year, go ahead and give it. Step 1 is the only, I will say, difficult, exam in the entire process. If you take and hit the biggest and the most difficult mountain, rest will be very easy to conquer. Okay, so this is a hot question always. For last 7 months I am getting, should we give exam now or in 2022? And I'm telling you, the unfortunate part of USMLE is these exams happen every day. So there are students who postpone these exams indefinitely, and there are students with goal who give it the exams in next 9 months, 1 year, and that's it, they are done. So my point is, don't postpone these exams indefinitely. Go ahead and write it when you are ready for this exam. I hope that answers your question. Didn't understand how score and pass fail coordination happens. Malaika, once pass and fail happens, what they will do is, in your USMLE transcript, they will not mention what is the 3-digit score you got in step 1. They will only say, yes, the candidate passed in first attempt. That's it. They will still release the marks for step 2 CK and step 3. The changes are happening only for step 1. I hope that clears your answer. We will talk about the match. Okay, we have not reached the match process. All right, we will talk about that. Again, the timeline and everything, I will come to that. So Mohammed Tayyab Ali is asking choice of specialty based on step 1. That will no longer happen. Now the choice of specialty will be happening based on step 2 CK marks. That is something which has changed. Earlier it was on step 1. Now it's on step 2 CK. So if you are hitting anything less than 220, your story of USMLE is over. Between 220 to 240, you get into psychiatry, family medicine, pediatrics, or pathology, okay, and internal medicine. And 240 plus, that's when you get into surgery, radiology, ENT, dermat, OBGY, these specializations. Okay, which is why we say your target has to be 240. And you're correct, Mohammed. Now it is over. Now, earlier, of course, based on step 1 score, you could decide on specialization. Okay, now let's discuss the residency application timeline. Okay, what is the timeline? What is the procedure? Let's discuss that. So typically, in your medical school, you are expected that you are going to clear your step 1, CK, have your degree, go for clinical rotation, build your CV, and get yourself ECFMD certified once you graduate. Okay. Now, those who are starting and doing it in parallel to med school, don't waste any number of years, okay, for application. But those who are graduates, please consider 1 year for step 1, 1 extra year for CK, clinical rotations and all those things. So technically, you will require minimum 2 years. Okay, individual timelines not possible. We are more than 300 students now. But yes, what I want to tell you right now is, if you are a graduate, you will spend 2 years for these all examinations, and after which you can apply. Application every year happens in the month of September. Once you make an application online, you have to apply to a program. What do I mean by program? A specialty and a medical college or a hospital. What do I mean by that? You need to apply to internal medicine, Mount Sinai Hospital, or surgery, Mount Sinai Hospital. So a particular specialization only, and that program director will tell you yes or no. Okay. So technically, you need to apply to one specialization because your entire CV will be dependent on that. Then, of course, you will have interviews November to January, February, where you have to submit your rank order or preference order, what we call. And in the month of March, the matching happens, and July onwards, your PG starts. So, two very important steps in this process. One is your ERAS application, where you need to submit all your documentation, SOPs, CVs, and second is your NRMP application. For this year's match, the deadline is 31st to register for NRMP. Okay, so the rank order has to be now started. Students have started filling in their rank orders now. Okay, now please understand what is happening in this matching process. Okay, if you are an international student, okay, Malaika was asking for matching, you will apply to, let's say, 100 hospitals, okay, for, let's say, surgery or medical medicine, whatever, assuming you are applying for surgery in 100 hospitals. Once you make application, depending on your profile, people get interviews between let's say 5 to 10 maximum, 5 to 10, okay, maximum, okay, 5 to 10 interviews. Now, pre-COVID, these interviews were offline. You have to go to America. Post-COVID, these are all online interviews. Right now, I've been practicing with all my students online. Okay. Now, once you are interviewed, you have, let's say, you interviewed at 5 places. So you will have a preference. I want first hospital in New York. Second hospital will be your California one. Third will be your Connecticut one. Fourth will be Massachusetts, and fifth will be, let's say, a university in Chicago. So that preference order you will submit in this NRMP. Similarly, let's say the hospital in New York, they have interviewed more than, let's say, 100 candidates, and they will have 40 seats. So they will also submit their rank 1, 2, 3, 4, what we call it merit list in India. They will also submit the same to NRMP body. Okay. So if you have selected this hospital at one number and even the hospital selects you in the topmost rank order, you get match and you can start your PG from July onwards. If the matching does not happen, you are unmatched and you participate in the SOAP. That's a last round for admissions. Okay. Residencies usually happen on J1 or H1B work visa. Now, on my YouTube channel of Moksh Academy, I have in detail talked about J1, H1B work visas. I have talked about this match process. So definitely you should refer that as and when you get time. All right. Rank order simply means Siva preference. What preference you have selected for a, let's say you interviewed in 5 places, where do you want to place yourself? Similarly, if the hospital interviewed 100 candidates, where do they want to place themselves? Okay. Now, the process looks complicated, but why do you think there is so much of demand and day by day more and more students are applying? The reason is in India, you can start working just as MBBS. Okay. Once the next exam comes, only thing is you'll have to appear next. You can still work as an MBBS. In America, you cannot work until and unless you've completed PG. So that's why the shortage is. Okay. They want PG doctors only. Okay. And the problem with them is they have more seats for PG and less seats for MBBS. In US, they call it MD. So they have more PG seat, less MBBS seats, which is why the gap and which is why more and more IMGs are getting admission. Okay. So I hope this is clear.